I talked to you before about when I'm reviewing files and I find codes that chiropractors really should not be billing. One of these codes is 96156, and this code is for a health behavior assessment or reassessment. And these are really more for psychologists, psychiatrists, they're not for chiropractors. When I'm reviewing the records, what I see that they're doing is they're putting a functional index in there. Let's call it a neck disability index or a revised oswestry, having the patient fill it out, and then they're billing 96156 when they've done nothing. All they've had the patient do is fill out a functional objective index. And that is not what this is about. No, health behavior assessment is a health-focused interview that you have with the patient outside of your regular evaluation and management codes. Cannot be billed on the same day as the E&M code by the same provider either. So this is when you're talking to a patient about a new diagnosis that can be traumatizing for them, or a chronic illness, and you talk about how they're coping with it, what their coping strategies are. Do they have a family unit to help them through it? Are they compliant with the medical treatment plan? So this code is really not appropriate for chiropractors to use. It's certainly not on the initial date of service, right? Because there is no medical treatment plan they've been doing that you need to see if they're following it, right? So 96156 is just not a code that should be billed by chiropractors, and certainly not on the first visit. Now, it's not to say I've had patients who get PTSD after car accidents or terrified to drive, they can't do it. I refer them to a psychologist and let psychologists deal with it. And maybe the psychologist is billing that code, I don't know. But it's certainly not one that I would code and feel comfortable coding myself. And it's not appropriate to be coded on the same day that you're doing a new patient eval or even a re-eval, right? It's a whole separate thing, and that you have to have a whole separate conversation about, oftentimes with family members present if that's an option. So if you're a chiropractor billing 96156, please stop doing so. And if you really think the patient has psychological or psychosocial issues that need to be dealt with, then please refer them to the appropriate healthcare provider.